Hi, Dr. Michael Craig here at the Whitefield Clinic of Dr. Spine. Today I want to talk about a very important subject called neck pain treatment in Bangalore and how you can go about getting the correct neck pain treatment for your back. Okay? Now, today we'll be looking at the spine, particularly the upper spine, the first 7 bones of the spine, which are called the cervical spine, otherwise known as the neck. And it also has nerves that come out from the spinal cord, which, as you know, the spinal cord comes from the brain and it goes down through the cervical vertebra all the way down to the tailbone. Each of these little yellow things would represent nerves that come out from the spinal cord and go throughout the body, all phases or all areas of the body. Now, the neck is very important because it does a couple of major things that most people are unaware of. First of all, the neck, which is very obvious, holds up the head and the skull. And so the head and the skull is a very heavy thing. The thing that gives that balance is the muscles and the nerves. And so the neck is very important for the simple reason that the whole spinal cord, in effect, passes through all the bones in the neck. Now, in Dr. Spine, we're primarily concerned about the balance of the spine. In other words, we start with the pelvis. I want to make sure your foundation is solid. And then we go to low back, mid back, and then finally the neck. However, things can start with the neck. If there's a headache, if you have a lot of headaches, if you have a lot of nausea or upset or dizziness, ringing in the ears, things like that, that could be a result of the neck being out of alignment, the bones being misaligned, and the nerves being affected. And so at Dr. Spine, you come, and what I want to do is a motion palpation. I'm going to move your head this way, that way. I'm going to find out where the problem is, and then we're going to do a couple of things. First of all, I'm going to adjust the foundation. I usually start with this, start in the spine. I usually start with the pelvis and work my way up, because if the foundation is not level, chances are the neck is not level either. Because there's another aspects of the neck that most people aren't aware of, is that there's something in the neck and the spinal cord that sends signals up and down from the lower part of the spine to the upper part of the spine. And if this part is out of balance, this may be affected as well. So what happens when you come in and you have pain in the neck, pain in the shoulders, and maybe you've got shooting pain down in the shoulders, maybe numbness or tingling in the arms and or fingers. Chances are that has something to do with the neck. It has something to do with the nerves in the neck, and all of those nest of nerves that come out of the neck and join together in what is called a brachial plexus. This nest of nerves also goes into the shoulder, into the arms, and into the hands and fingers. To correct that, if we simply correct the spine at the level or at the source of these nerves that go out into that area, you can effectively change the pain levels, you can eliminate the pain, you can get rid of the numbness or the tingling, and you can regain your health. Now, how do we do that? Now, the first thing I do is I do an examination when you come in. I'm going to check your spine from the pelvis on up. I'm going to find out which way your shoulders are leaning, which way your head is leaning. I'm going to look at your back, see if there's any scoliosis or any excessive curvature in the spine, any leaning forward jutting or leaning back, things like that. I'm going to look at the neck, particularly if you do work, and there's a lot of people in Whitefield who do work at desk jobs, IT jobs. They're always on computers, they're always leaning forward, and they're always looking at the computer screen. So there's several things at play here. First of all, there's strain on the eyes from doing so much computer work. Secondly, they're sitting at the desk. When you're typing at the desk, you're leaning forward, your back is hunched, and you're on a computer all day. So if that happens all day, then you're going to have some problems, particularly in the neck, upper back, and shoulders. And headaches result because of the pulling on these muscles in the upper part of the neck can pull on this part called the occiput. It can create strain in the head and in the neck, and just create problems. So your neck pain comes about primarily because of your posture, but it can also happen as another cause, and that cause has to do with internal function and your diet, what you're eating, whether or not it affects the liver or the gallbladder or some other organs in the body. These things can also affect how the neck functions and whether or not you have headaches whether or not you have blurry vision, whether or not you have ringing in the ears. All these can be affected by organ dysfunction in the body, as well as by muscle strain, sprain, or toxicity. So at Dr. Spine, I do my physical examination. I find out what's going on in the neck. I find out whether or not there's a curvature in the neck. Now, normally the neck has a particular curvature. It's very even, and even all the bones are evenly spaced, and there's no arthritis evident in the spine. When this progresses, in other words, if you have an accident or if you have a whiplash injury, something that happens, maybe you fell as a child. Now, phase one is just when you lose that curve in your neck. The first thing is a normal neck has a curve. Phase one means you lose that curve, and with a straight spine, it's what we call a military neck, and that's very conducive toward more and more injury and more stress in the spine because it doesn't absorb up and down motions as well as a curved neck. Phase two is when you have a little bit of arthritis starting to appear in the spine, and phase three is when you have more arthritis and you're getting up in years and you haven't had any treatment at all, and the bones in the neck start fusing, they start joining together, and you have very, very limited motion at that stage. So to prevent that from happening, the best way to get things done is to get chiropractic care early on so that you don't have these problems developing. Now, there's several ways that we correct that. One is that we use chiropractic adjustments. I can use physical manipulation, in other words, I may lie you down. Usually it's face up, and I can do a face up adjustment. I can also lie you face down. We can adjust that way. Finally, the thing I do is I put people on a traction unit. At Dr. Spine, we have manual traction units, which came from the United States. We use these units to help pull the spine away from the nerves. In other words, the vertebra could sometimes compress, and the disc can become compressed, and also there can be a little bulging out of the disc, which can cause an irritation to the nerve roots. When that happens in the neck, then it's what we call a pinched nerve, and in order to eliminate that, we want to pull on the head and the neck a little bit, and these traction units are designed to do that. I want to demonstrate how that works. This is controlled by the patient. We do have machines in the U.S. that are automatically motorized and can pull on the neck and do things. This is better in many ways because the patient controls the amount of force that goes on. So it's like a bicycle pump, and we just pump it up like that. And so once I get to about 30 pounds of pressure, and you can measure that on the little dial there, 30 pounds of pressure, and I usually have someone lie there for about 2 to 3 minutes. And after about 2 or 3 minutes, I teach them to release the pressure, and you just press this button here to release the pressure and let it out for about 30 seconds. And that's generally enough to what is called intermittent traction, where you're pulling on the neck and then you're releasing the pressure, pulling on the neck, releasing the pressure. This is to take the pressure off the spine, off the nerve roots that come out from the spinal cord through the neck vertebra and can affect the muscles and the organs and the rest of the body. So again, it's just a matter of pumping it up. And again, if you come to Dr. Spine, we'll show you how to do this. But this is a very good tool, very useful tool for helping people recover from neck pain, particularly if it infringes on the nerve roots that come out from the spine.